As we heard about already today, there is this AI initiative from the German Ministry of Economy that was started actually in the beginning of 2019. There were several projects applied for this funding, and finally, from the beginning of 2020, there were 10 projects funded, and we are one of them. We are called EMPAIA. It's the ecosystem for pathology diagnostics with AI assistance. And today I'm going to drive you through the main ideas and give a brief introduction into that one. So first of all, as you might have understood from the title of the project, it's a project that is mainly focused on one domain in the medical domain. It's pathology, and the role of pathology and precision medicine. So for all of you who are not familiar with pathology, it's quite far away from how you understand pathology from the media. So we are the pathologists are mainly those physicians that are involved in more or less any diagnosis of patients that is done in the hospital, because they are finally looking or have to look at all the specimens that are taken out of a patient during any intervention and do the final diagnosis, which they then give back to the clinicians and discuss, which then decide upon the treatment. So the diseases which pathology mainly deals with are, of course, it's a large variety. Mainly it's autoimmune diseases, cancer, or even degenerative or infection diseases. Regarding the use of AI in pathology, I brought this small graphics here so that you understand that in the last years, there were mainly data pathology, the term which were found in many publications, but over the last years, we tried to see, okay, what is deep learning, histopathology, and cancer associated. So when you search for these three terms, you see an exponential growth of publications, and this is only the statistics here, it's only until 2018. So but I can tell you that even that still in the last years, this growth has moved on like this. So this means that, of course, AI in the digital pathology domain is gaining more and more speed and importance. But now to come to the typical AI concept today. So, and this is not only true for pathology, but also for a lot of other domains. Normally you have, coming back to pathology, normally you have some kind of tissue image, so a high magnification image of a tissue, of a stained tissue sample on a glass slide, and you put it into some kind of black box algorithm and processes the data. This gives you some classification, and as a result you might have something like in the tumor domain a differentiation between tumor and non-tumor. But the decision itself is mainly not explained. We also heard this in some of the previous talks, that explainability of artificial intelligence has become a very important topic, not only for having users confident with the result, but also for regulatory reasons, which might be also discussed in this parallel session to this one here. So now what I wanted to show you here is a short introduction and a use case example for cancer diagnostics. So here you see again another region of interest from a tissue slide, and here's a tumor region in that image, and you also have other regions here, like the one in the smaller circle or a smaller ellipse, which mainly shows immune cells. So what then a classification algorithm might do is that it classifies and do some kind of quantification of immune cells as a basis of therapy, and visualize this this result as some kind of a heat map. And then if you take the heat map and overlay the heat map to the initial image, you get some kind of this result here. And then you put all of this into a cockpit, which is then used by the pathologist, and you give also some quantification information, like the percentage of tumor infiltrating lymphocytes, which is here important for the therapy recommendation. And this gives a quite good example of how explainable AI, or a first step of explainable AI, has to be in the future, because this not only gives you the pure number of 62% in this case, but also let the medical expert understand, in this case, is the AI classification and quantification algorithm working correctly, and why is it coming to that result that it showed here. When we are talking about the digital pathology market, so because we are, as I said, we are a project that is funded from the AI initiative by the German Ministry of Economy, we of course are interested to see, okay, how to strengthen the also the market and the economy in Germany with regard to AI and application to pathology. And here I present you some numbers regarding the market of pathology in general. So you have like 10 million cases in diagnosed cases in Germany, 50 million in the US, and worldwide approximately 350 million cases per year. And nevertheless, in all of them, you need, the requirements are precise and fast pathology diagnostics, which is an increasing demand, of course, because as you might know, there is a shortage in pathologists worldwide, which is problematic to having fast turnaround times and fast diagnosis times. And on the other hand side, you have an increased complexity of the diagnosis because of the introduction of omics data and molecular pathology information into the diagnosis, and not only taking into account the histopathology, so the image-based pathology, how it was in the last years. Another aspect to give some idea about the market and how is the market developing is this revenue table here. And I don't want you to go into the detailed numbers. The only information that you should take out of this graphics is mainly that over the last 4 years, the expenses and the revenue for software has doubled. Whereas, as you can see here, also the hardware investments and revenue are quite high in the digital pathology market. This is due to the high costs of whole slide imaging scanners, so of those devices that you use to digitize the glass slides. But nevertheless, if you compare the increasement of the hardware revenue with the software revenue, then you see that the software revenue is growing much faster. And this is also an indication that more and more software is more and more important in the digital pathology domain, and also gives the opportunity to give a market for AI algorithms being applied in this domain. So from the status quo, from the clinical perspective, is actually, as I already said, there is a rapidly increasing number of AI solutions, but most of them are not applications in clinical practice, because they are only allowed for research, because there are some problems from the regulatory side to certify algorithms for the clinical use. And this means that finally, even if there are already some AI algorithms in place, there is no impact on physicians or even on the patients right now. And this is something which we really have to overcome, and that's where we started with this project. So the result of, or not the result, but the situation also shows that there are a lot of proprietary solutions on the market, and there are not even sufficient standards that can be implemented by the companies in terms of exchange between hospital and laboratory information systems. We of course have standards like HL7 from the IG or FHIR, and of course also in terms of image exchange we have DICOM. Nevertheless, none or not all of them are really sufficient for a clinical practice use, and this is also something which we wanted to address in the project. Besides this, there are these unresolved legal and billing issues. So legal, I already shed some light on that. Billing, of course, you can understand that the payers are only paying for those solutions that are in some way certified. And as I told you, there are no clinical applications certified, or no applications yet certified for clinical use. So also the billing and the reimbursement for the vendors who are developing such algorithms is a problem. And last but not least, as already presented and heard in several talks before, there is no real standards in explainability of the decisions of AI. They are first developments. Of course, they are also first framework like Lime and others that we have already heard about today, but still it's a problem to address. So what we identified here is mainly that there are several hurdles to the market from the perspective of the vendors who are developing the solutions. This means, of course, you mainly have a great idea coming from the university or even from some hospital department, like some university hospital here. But then you need some data. So this is mainly the first hurdle you have to take. So how do you get access to data in terms of GDPR and other regulations? And then if you might pass this hurdle, then you might be able to create an AI solution. But then you have to find someone who validates your solution. And so you also, as a small startup company, even when you have a very big know-how in the technology, it's still complicated to find this this validation or study group or data to validate your solution. Once you've passed this and you are somewhat market ready, you actually also, to gain some reimbursement, finally, you need some kind of certification, either if it's MPG or if we are talking about IVDR, or even if we are talking to going to the US market and talking about getting an FDA clearance. All of this costs a lot of money, and also yeah, it's probably not easy to cover for smaller companies and for startup. This means there is also some grouping to bigger companies, or that, for example, you are incorporating your solution into solutions of other bigger companies who can cover that hurdle. This is also something which we wanted to address here. Then, of course, still, when you are if you have even passed that one, then you go into your customers and you find a large variety of different systems in the installations there. So, for example, in Germany, there are in the pathology domain, you have mainly 2 vendors that are sharing 2/3 of the market for the pathology information systems, and then you have 10 other vendors sharing the last third. So this means to cover only the German market, you would have you probably would have to make interfaces to approximately a dozen systems for only getting data from the hospital or a pathology information system and pushing the diagnosis data back to it. So this also is a lot of investment. It requires a lot of investment, a lot of efforts. And finally, yeah, of course, also the billing aspect. So how to get involved with the payers itself. And that's why we thought about, okay, how to address all these hurdles. And as I said, we are focused here on well, this graphic is also focused on the service providers, so on the developers of those algorithms. And mainly, we are talking about that we are having some AI application development on the first run. Then we are working on some kind of validation and certification with dedicated partners to distribute the solution and get it into the usage. But then also going back to have the users on the solutions and improve it and increase or add some additional development, get some recertification, and giving it back into the usage. And this is some kind of life cycle that we also wanted, or that we are going to address within the project right now. The sources of innovations within the EMPAIA projects are mainly originating from the customer needs, the market environment, the future perspectives, and the recent available technologies, and also, of course, the decreasing costs with these technologies and the increasing power of those technologies, but also, and this is very important, the digitalization that has occurred in the pathology domain in the last years. So most of the bigger institutes in, if not all of the bigger institutes in Germany, for example, already have slide scanners. So this means they are able to digitize the slides, which is of course the first step to start for applying AI algorithms in the clinical diagnosis. And of course, also it's more and more possible to do some seamless integrations of AI solutions based on these image data, and also have some automation here. Regarding the consortium, I wanted to only give a very short introduction to that one. So we are founded by the, as I said, German Ministry of Economy. Charité is the consortium lead in this consortium, but we are very closely working together with Fraunhofer Meyers, with the DAI laboratory from the Technical University of Berlin, with the QUIP, which is a spin-off of the German Society of Pathology and the German Professional Organization of Pathologists, and another service provider. We are having to address all these problems that I mentioned before. We decided to establish at the moment 4. Well, there's a 5th one to be raised right now, but we are developing those committees which cover certain aspects of the problems that we are addressing. So, of course, there's the standardization. So we are in a close collaboration with the DICOM Working Group 26, which is responsible for standardizing the image formats in pathology and the exchange of those images. And with the IHE PALM group, PALM stands for Pathology and Laboratory Medicine. And we are seeing together with the industry partners how to integrate the algorithms into certain workflows. So this means there are also, of course, a lot of APLIS vendors, not only national, but from an international basis on that committee. Another aspect is the profitability and billing of these AI solutions for routine use. The testing and the validation of the algorithms, so how to assure that not only the vendor tells the solution is working perfectly, but that some kind of a neutral, objective certification group can say, okay, yes, it is something like this. You can think of things like the TÜV, the DEKRA, or something like this on a general market, but for medical and especially for the pathology domain, that's not so easy to solve this. This is something which we also, where we also see the QUIP, the partner QUIP in this domain. And last but not least, the legal questions when you're finally using AI algorithms in the digital pathology domain. So what does it mean if you are applying an algorithm and it gives you some quantification of a certain cell type, and the algorithm just fails, and based on that quantification you are proposing a treatment, but due to the underlying error of the algorithm, you are having a bad treatment to the patient, and the patient has a problem and sues you. So who is finally responsible for that? Is it the doctor who was not explained enough by the algorithm and should have not used the algorithm, or is it the manufacturer of the algorithm who should have produced the algorithm in a different way and gave more information to the physician finally to better understand if there is a problem? So as you can see, there are problems to address, and that's one of those committees going to do. Together with that, we are having reference installations all over Germany, but also some international reference centers. The German reference centers are divided into 4 groups because they have very different demands on how they are using AI algorithms, and also into how to integrate it into the workflow, and how the daily practice looks for those groups. And that's mainly the private practice pathology labs, medium-sized labs, hospital chains, and university departments. Regarding the realizability, We mainly wanted to address these four points here. So it is very important for us, of course, to have a very good user acceptance. That's why we also started to integrate those reference centers from the very first moment into this project. We wanted to have a large industry acceptance, because as you can understand, when you think of building an ecosystem, this means you have all the stakeholders on the table. So the users, the developers, and also the legal certainty. And there we come to groups like having the society, the professional organization, the German Society, the Scientific Society in the group, to have some companies into the group that are dealing with validation and certification from the scientific point of view, but also, of course, lawyers to really address the legal problems that are not only true for the pathology domain, but also for the medical domain in general. So, of course, by now I only talked about the pathology domain, but as you can clearly see here, and probably also already understood, that this is not these concepts are not only relevant for pathology. So we are of course starting with the pathology domain, and we are starting with Germany, and then we are enlarging our efforts into the DACH region and also into Europe. And that's why we are also having other European and even worldwide reference centers. But once we develop a first walk through these topics, like as you can see here, it's the data access, AI solution development, and so on and so forth. We are also thinking about to enlarge these efforts into other medical domains, like one that is very close to pathology, and which we might already incorporate within the project. So this project is running for 3 years. So probably from the last third of the project, we are also incorporating, aiming to incorporate radiology. But also even after that, there are a lot of other domains that might be incorporated as well. So that's one list, so just to show you who is on the industry part. This is the list of it's not even a complete list anymore, but it's a list of supporters. And as you can see here, it's by far not only German companies, but also international acting partners, which is very important to really have this project as a success story. And we are not only talking about companies that are saying, yeah, it's a good effort, we are supporting that, and guys, you will do a great job. No, they are really actively supporting this, also by personnel, also by financials, also with developing interfaces to our systems and adding interfaces to their systems. So it's really a very good effort that all these companies are doing. And yeah, with that, I like to finish my talk for today. So thank you very much for your attendance and your patience. I think it was just quite in time. So if you have any questions, I'm happy to answer them. Thank you.
Yeah, thank you, Norman, for this practical application of AI in the medical field.